Hello and welcome to Fruitan Academy. Did you know that vitamin D deficiency is a global health issue affecting more than 1 billion people worldwide, with around 50% of the population estimated to have insufficient levels? This vital nutrient does far more than just strengthen bones. It plays a key role in optimizing immune function, supporting cardiovascular health, regulating mood, and may even help prevent premature death. Yet, a significant number of people have low vitamin D levels, increasing their risk of osteoporosis, muscle weakness, and other chronic health conditions. In this video, we will focus on practical strategies to address vitamin D deficiency and insufficiency through a balanced combination of sun exposure, diet, and supplementation, including an advanced option, Calcifediol, which can rapidly raise vitamin D levels. If you're interested in an in-depth understanding of vitamin D, including its biological functions and the methods used to measure it, be sure to watch my first video linked in the description. Vitamin D results are generally reported in two units, nanograms per ml and nanomoles per liter. To interpret vitamin D levels accurately, here is a quick reference. Levels below 20 nanograms per ml or 15 nanomoles per liter is considered deficient, while levels between 20 to 30 nanograms per ml or 50 to 75 nanomoles per liter indicate insufficiency. Ideally, levels above 30 nanograms per ml or 75 nanomoles per liter are recommended for optimal health. However, it's crucial to note that levels above 150 nanograms per ml or 375 nanomoles per liter may indicate toxicity, which can lead to serious health risks. To effectively correct vitamin D deficiency, a comprehensive individualized approach is recommended, focusing on three main strategies: sunlight exposure, dietary sources, and supplementation. Let's now go through each one. Sunlight is one of the most effective natural sources of vitamin D. Exposure to UVB rays, particularly during midday, enables the skin to produce vitamin D efficiently. However, there are several factors that influence how much sun exposure you need. Geographic location. People living farther from the equator experience less intense UVB exposure, especially in winter, reducing the skin's ability to produce vitamin D. Skin type. Melanin, the pigment responsible for skin color, absorbs UV radiation, so people with darker skin require more sun exposure to produce the same amount of vitamin D as those with lighter skin. Age. As we age, our skin's efficiency in synthesizing vitamin D decreases, making older adults more susceptible to deficiency. While sunlight is beneficial, it's also important to balance sun exposure with skin protection. Sunscreen plays a critical role in preventing skin damage and reducing the risk of skin cancer, but high SPF sunscreens can block UVB rays, potentially limiting vitamin D synthesis. Research indicates that incomplete or inconsistent application of sunscreen may still allow some vitamin D production. For a balanced approach, consider brief, regular sun exposure on areas not covered by sunscreen, while protecting high-risk areas with sunscreen or clothing to support vitamin D levels safely. Dietary intake of vitamin D can be especially useful for people with limited sun exposure or those who live in areas with low UVB light during certain seasons. However, vitamin D is naturally present in only a few foods, so it may be challenging to obtain adequate levels from diet alone. Here are some vitamin D-rich foods to consider. Fatty fish like salmon, mackerel, and sardines are among the richest sources of vitamin D. Fortified foods. Many dairy products, plant-based milk alternatives, and cereals are fortified with vitamin D, making them convenient options. Egg yolks. Eggs provide a small but valuable source of vitamin D. UV-exposed mushrooms. Certain mushrooms contain higher vitamin D levels when exposed to UV light. While dietary sources can contribute to maintaining vitamin D levels, they may not be sufficient for everyone. For people with health conditions or dietary restrictions, additional supplementation may be necessary to ensure adequate intake. Vitamin D supplements can be a highly effective solution for addressing deficiency or insufficiency, especially when natural sources are limited. Here is a breakdown of the different options and guidelines for supplementation. Most experts recommend vitamin D3 over D2 as it's more potent and effective at raising and maintaining blood vitamin D levels. While slightly less effective than D3, vitamin D2 can still be beneficial, particularly for individuals with dietary restrictions such as vegans. Recommended daily intakes vary by region and individual needs. In the US, for example, a daily dose of 600 to 800 international unit is suggested for adults, with higher doses of up to 4,000 international unit deemed safe for addressing insufficiency. For moderate deficiency, 1,000 to 2,000 international units per day is often prescribed, while severe deficiency may require up to 10,000 international units daily under medical supervision. Emerging research indicates that calcifediol may provide a more rapid correction of vitamin D levels than traditional D2 or D3 supplements. This is because calcifediol is the 25-hydroxylated form of vitamin D, which bypasses the slower liver conversion step required by D2 and D3. As a result, it enters the bloodstream ready for use, needing only further hydroxylation in the kidneys to become the active form calcitriol, or 1,25-dihydroxyvitamin D. This makes calcifediol especially useful in clinical settings where rapid correction of vitamin D is necessary. For instance, ICU patients, particularly those suffering from critical illnesses like sepsis or respiratory failure, who often present with low vitamin D levels. Timely correction of vitamin D deficiency is thought to be beneficial in such settings because of vitamin D's role in modulating the immune response, reducing inflammation, and enhancing recovery from acute illnesses. Research suggests that ICU patients with higher vitamin D levels have improved outcomes such as better respiratory function and shorter stays in intensive care. While not commonly prescribed worldwide, calcifediol is available by prescription in several countries, including Spain, Italy, and the United States, where it's used particularly in patients with severe vitamin D deficiency or in conditions where rapid restoration is required. While vitamin D is essential, it's also important to avoid excessive intake, as very high levels can lead to serious health risks such as hypercalcemia, kidney stones, kidney damage, and organ calcification. Toxicity symptoms include nausea, vomiting, weakness, frequent urination, and organ calcification in severe cases. It's therefore crucial that vitamin D supplementation is tailored to individual needs. Regular monitoring of vitamin D levels helps ensure optimal dosing and prevents potential toxicity. By balancing sunlight exposure, dietary intake, and supplementation as needed, you can effectively address vitamin D deficiency or insufficiency. Always consult with a healthcare provider to determine the best approach for your unique needs, ensuring a safe and effective plan for reaching optimal vitamin D levels. With that said, thanks for watching, and I hope this video was helpful.